Rainbow Health Initiative, promoting essential resources to improve community health.
Rainbow Health Initiative, expanding access to culturally competent care.
Rainbow Health Initiative, reducing the harm caused by alcohol, tobacco, and other drugs.
Rainbow Health Initiative, ensuring that LGBTQ health is a part of the public dialogue.
RHI's mission is advancing the health and wellness of lesbian, gay,
bisexual, transgender, and queer communities through research, education, and advocacy.
In 2001, a group of community activists, healthcare advocates, and providers noted a significant health disparity among Minnesota's LGBT community. They decided to address this disparity and founded Rainbow Health Initiative.
LGBTQ people experience health inequities in the form of limited access to health care and obstacles to culturally competent health care as a result of societal discrimination and stigma. Not unlike other marginalized communities, LGBTQ people experience hurdles in terms of access to health care, disproportionate use of alcohol and other drugs, have lower rates of insurance. And in addition, LGBTQ people are often at risk to experience homelessness and at greater risk of committing suicide than the general population.
We view those goals through the lens of research, education, and advocacy in order to help us focus our work to address those health disparities. From our mission, our focus areas are tobacco, healthy eating, active living, substance abuse, and social support. Activities include health promotion, policy change, training and presentations, events, resource sharing, coalitions and community partners, and our annual health assessment survey. Rainbow Health Initiative is probably most well known for our tobacco work. We're responding to the large number of people in our community who struggle with the harmful effects of tobacco and secondhand smoke.
The relationship between the LGBTQ community and the tobacco industry goes back many years. From a time when no one else wanted to be associated with our community, they were a friend. They offered funding to our community. They were at community events. They gave us free products. They said, "We like you." They put their ads in our magazines. And so what that's created is this feeling that they're somehow on our side or that they're working with us. When in actuality, due to our high prevalence of tobacco use, it's the #1 killer within the LGBTQ community.
Compared to the 16.1% of overall Minnesotans who smoke, the LGBTQ community has a tobacco use rate of 41%. They want you, but so do we. Visit shiftmn.org for more information.
SHIFT is a program of RHI that is geared towards tobacco control. The focus of SHIFT is to engage with 18 to 29-year-olds in tobacco control activities like policy, education, and media.
Rainbow Health Initiative hears from all sorts of folks that it's hard to get access to decent health care. Lots of people are afraid to come out to their providers because they're afraid that they will be denied care or that they will receive subpar care. Every year, Rainbow Health Initiative collects a community health survey. The survey is so important because there's no national survey that collects data on race, sexual orientation, gender identity, and health all in one survey. RHI uses the health survey to provide tailored trainings to medical professionals, students, organizations, and other groups in order to provide LGBTQ competent care.
We are champions for data collection.
And we are thrilled that you're here. We are especially thrilled that we have representatives from national, state, county, and city governments, as well as insurance companies, healthcare providers, and other organizations that serve the community.
Public health is what we as a society do collectively to assure the conditions in which people can be healthy. So we need data about all aspects of society. We need all people working together collaboratively to address the needs of everybody. And we need to reduce the disparities that are there. If we don't reduce the disparities, we will not be a healthy state. And the thing about disparities, it's not a zero-sum game. It's not if people at the bottom get better, people at the top have to get worse. Actually, everybody wins.
LGBT identified people need to have this kind of research and data so that they can understand the health issues and concerns within their own community, but also more broadly, policymakers and healthcare professionals.
This is great because this then takes it into the adult community to look at the 18 to 65-year-olds. How do we compare as LGBT people to the broader community?
I have been really impressed with the advocacy and the level of skills and commitment that Rainbow Health Initiative has shown in our state, and as a member of the LGBTQ community, I feel it's really important to stand behind Rainbow Health Initiative and step up with them in this fight, because we have made tons of progress, but there's so much more advocacy to be done to create a vibrant and healthy LGBTQ community.
Perhaps less visible is this advocacy work. We work in numerous partnerships and collaborations to advance the issue of LGBTQ health disparity.
RHI works to advocate for LGBTQ people by making sure that we are not left out of mainstream research, decision-making bodies, and funding opportunities. Our staff and health advocates work to ensure that LGBTQ health is a priority at state and local levels.
Rainbow Health Initiative acts as a bridge between our organization and other organizations, between individuals and organizations, and between individuals and their providers. We work to connect people with the resources that will help enrich their lives to be as healthy as they want to be, as healthy as they can be. Rainbow Health Initiative promotes essential resources through our events. We're at tons of events all year round where we're promoting community health resources for individuals to come in contact with that hopefully they can use at some point during their life. We do health promotion and outreach, as well as link folks up with not only our programs, but other programs that exist.
Rainbow Health Initiative also provides the community with a resource through our provider directory. We list LGBTQ-friendly providers on our website that are in the metro area and in greater Minnesota.
Recently, we've begun a recovery program for members of our community who struggle with substance abuse issues, another major health issue.
Proud Recovery has two objectives. One, to recruit and retain community leaders as peer-to-peer coaches to support people in recovery. The second objective is to work on creating toolkits. These toolkits can be used by organizations to be more LGBTQ competent, or by LGBTQ organizations to be more recovery competent.
There are so many other health disparity issues that we could and would like to address. Things like mental health, housing and food insecurities, access to insurance, competent health care, just to name a few of them. But we can't do it all without your help.
I'm involved with RHI because I believe that Minnesota is really fortunate to have an organization like Rainbow Health Initiative. We need to have a voice at the table, and we need to support this kind of an organization if we're going to really achieve true equality in our state and in our country.
In order to do this work, we need your help. We need a much larger base of support. And so, I would like you to consider helping us address the health disparities in our community and advance health equity for the LGBTQ community.
To join our effort, visit us online at www.rainbowhealth.org or call us at 612-206-3180.